and your mind is not accepting or doing something, or
Okay.
consistently you're fearful, right? Even that can be an emotion that can trigger stress. Of course, physically, when it shows, it's definitely, has done a lot of harm, and then, physically also it starts showing. I'm not saying every pain is a stress related ailment that person may have, but if it is something that regularly a person suffers physically, then yes, could be because of stress. If there is a regular, recurrence of something, stress could be one of the criterias for it to come in.
Okay. So, how do you identify that? How does a person identify himself, or the other person identifies that the person is stressful or has any problems, mental or physical?
So it's both ways. Means a person can also identify a lot of times. So I'll just like to, here add that sometimes people can understand. Sometimes you need the help of a person to help you identify your emotions. Sometimes you're only saying that you may not even say that in stress, because people construe stress as only a financial or relationship. Sometimes you don't even realize that this is a stress that I'm going through. So
Okay.
sometimes a counselor or a therapist can definitely help the person identify, okay, this is the reason, or these are the underlying emotions which are, causing you to, worry or excessively think. And what is stress? If you're not sleeping because of excessive thinking, isn't it stress?
Yes. True. True. True.
So, for different people, it could be different. And sometimes, even if they say that, I'm overthinking, but they never call it stress. Because, the moment you feel, the moment you, I mean, stress is the final outcome, which is like a more larger thing. But yes, overthinking could be one. Fear is such a big one. Anxiety is anxiety is another commonly used word. But there could be very different reasons for different people to have anxiety.
Like what in our profession, what we see is whenever a patient comes with a jaw pain, TMDs, or you say head neck in region, so there is a relevant history of stress which is always there. So now, as an adjuvant therapy, we would like our patients to go to a counselor as well. So does counseling session help?
So it helps to people who would like to understand, because there's a lot of barrier, I will say, Sayamita, that, people don't want to, the moment you say, you have to go to a counselor, or you have to take something, or, do something for your stress, people think we've, told them you're weak.
Yeah, true, true, true.
That's not true, right? If your muscle can pain, your muscle can be weak, but if your emotions can also be weak, why not go and strengthen them? I mean, it's just the same. It's just that the moment it is a little tangible or intangible thing, people think, you're pointing, saying that you're weak because you're going to a counselor. Even for smallest things that, your emotions which could be of issue, people do think that you're pinching them on the wrong side by when you say them, okay, work on your stress or work on your emotions or work on this. It just seems that you're pinching on the wrong side, but that's not true. It's just a part of you, means in fact more part of you than your physical part of you, because your mind is everything.
So does that can the stress affect your body pain as well as immunity?
Yes, it can. It can. A happy mind is, as I said, there are people who have a victim attitude and there are people who have a survivor attitude, right? So,
Okay,
what is the attitude? Attitude is your mind, right?
right, right, right.
So it can, but I don't want to say that, everything is like that. No, if your mind does play or complements your recovery very well. If your mind is on your side, and, the complementing that your mind can do while the physical ailments are being managed by the professional who is supposed to be managing, but you work on your mind, then that just adds to the person's recovery rate. It's much faster. It's where I would leave it.
Okay, okay. So how do you treat patients? I have been sending patients to you as well, right? So how do you
Yeah.
treat them?
So
Please
for
enlighten.
me, of course, I am not. I don't do counseling per se. And you know that I work with batch remedies, and for me, everybody who comes to me has to accept that they have to take batch remedies. Now, what are batch remedies? Batch remedies are basically flower extracts which are inspired by homeopathy, were created by Dr. Edward Bach, who was a physician of the normal stream as well as a homeopath. And when he was working with his patients, he realized that the mind was playing a lot of difference. While he was prescribing the same medication for physical symptoms to be the same, but a mindset of the person was deciding the rate of recovery. So that is when he wanted to do something about the emotion side of it, and that's when he created these batch remedies, which is a set of 38 flower essences which work on the emotional side of the person. So each flower essence works on a particular emotional characteristics and helps in alleviating you or moving you up the ladder there.
So when you say emotions, can you help the crowd relate to the certain emotion and help them understand which issues can be solved?
So I will be honest, physically, an emotion can manifest anywhere, right? With an emotional issue, people can have extreme things also, or people can continuously get dressed, for example, blisters. Regular occurrence of blisters, regular occurrence of headaches are also signs of stress only. But there could be, for some it may manifest in much larger this thing also. So, for example, let me just take this now. When I say, can I share my screen here, Sayogita?
Yes, you can.
Yeah. So, can everybody see my screen?
Yes. Yes.
So I'll just
Yes.
actually move this out here, and I will just, for example, let's identify what we call as stress and what we don't call as stress. So let's just see. Worthless. Do you think people actually worry about being worthless? But that could be a trigger point for somebody to start feeling low about themselves. And that is the entry point for stress. People don't think, a person when he's appreciated, how happy he is. But the moment he's, told he's worthless, even for 1 second, his emotion dips. But people think, this is like, why did you say that? Person shouldn't have told me, but I may not want to. For example, desperate for something. Can it be a trigger? Yes, it can be. It could be the trigger point for your start. You get desperate for something and then you overwork, you do X, Y, Z, you get, for example, now if I were to say grief or sorrow, do you think there are people who are in grief or sorrow for events that have happened or loved ones that have gone and they're not able to move their life? That could be a trigger for somebody. But what happens is mostly the event is being taken into consideration. Okay, that this is because of this happened to me, that I'm like this. But how do I overcome the grief or the sorrow? I don't think people think like that. For example, confusion, it's such a big one with kids. Teens are so confused about what they want to do, how they want to go do, and the whole peer pressure that comes for them can be only from the point of view of they don't know which choice to make. So even small things like this, actually, these are small emotions that actually create the bigger ball of stress. Being bullied, intimidated, or being frightened about certain things, that could be there. And just see, if you're feeling confident even for once, then your mood is different, your ability is different, you're in a different zone. But if you're in this red side, you're different, nervous, overthinking. How many people overthink? An episode that happens, say, on Monday is like going like a gramophone till Friday, has occupied that person, right? But people don't consider this as as stress. So if you were to ask me what is a stress wheel, I would say it's like this. It can be for anybody, it can enter like this. You can be irritable, then you can become less efficient, and you can enter with being discouraged, or you can enter by feeling guilty. Because you feel guilty, you do excess work, then you overtire yourself. When you are overtired, you become irritable. So it's like a cycle, and anybody can enter the stress cycle with the trigger that they may have. If you're feeling less confident, you will you will be ashamed, or you'll be feeling XYZ, and then you enter that. When you're in public gathering, you may feel completely confused about certain things. So a stress cycle, and anybody can enter through anything. It's not necessarily going to be any specific. Anybody can enter through any item of emotion that could be a big reason for stress.
Okay. So, what are Bach flower extracts? Are they inhaled or they're consumed? How do they work?
So I'll just show you how bach flowers look, because a lot of times people think, bach flowers are something that uh, I'm going to make them. Just a second. I think my screen has just got a little stuck, but let me just start it again. I'm sorry. So bach flowers are actually, these are remedies which are made by mother tinctures, which is like how homeopathy is made. So like a proper mother tincture is created, and then there is a proper factory setup in which, the bach remedies get created. So, they are bottled by, people who make homeopathy medicines. Is my screen viewable to people? So see, this is how actually the bach remedies get created. There's a proper manufacturing facility.
Okay. You have been there?
What happened?
Have you been there in this factory?
Yes, I have been. I've been to this factory. This is a setup which is in London, and I have been to this factory. And this is an actual video recording of how bach remedies finally get bottled. So, I'm just going to take a minute and just show you the clip. I'm sorry, I was just in back-to-back meetings, but yeah, I'll just stop share. And if everybody can see my screen, see, this is how they look. Can everybody see my screen? They're actually like this, a kit of, flower essences. And, this is how we use. Each remedy has a specific item. I hope everybody can see what I'm showing.
Yes, yes.
Yeah, so this is how bach remedies look. They are made in a factory setup. They are not inhaled, or it's not like you're doing an aromatherapy. It's like a homeopathy. It's inspired by homeopathy, though I can't call it, because it doesn't work on physical symptoms. It only works on emotional symptoms. So these are 38 of them, and each having a specific. So a lot of homeopaths actually learn this. A lot of people who are on the other side of, for example, homeopaths, skin specialists. Of late, I got people who are Ayurvedic doctors who do have certain things that they can create it, but they know that this is more like a psychosomatic case where stress is playing a larger role for the person. They have started actually learning this as added skill, and then providing the help and support, because any which ways they are consulting the person. So this becomes an added remedy that they can give to the person who's coming. So actually a personalized mix gets made like this, like a bottle, and this is how, and then you actually consume it. So you consume these remedies.
Okay.
So these are consumed remedies, and it's personalized. As I said, there's no off the shelf saying, okay, you are stressed, take this. Who is stressed for what reason is what you assess with the person and then give the person.
Okay. Suchitra, now, like you said, these can be taken. We are in different parts of India here. And how will it be possible for us to send you a patient, or is it possible that you could teach us this as well?
Yes, I have been. Teaching online, and what is happening is people are learning this as an added skill. And what I do is I tell them, okay, these are the 38 remedies, these are the basic emotions. Okay, of course, people who want to become practitioners for it will have to study further to get a certificate and just be called like I'm a bach practitioner and trainer. So for me, I have to, but like people who are going to use just a supplement, right? And they understand the emotions. They already know what what is that they could be suffering from, or if there is a fear, for example, in your case, because most of you guys are from the dental side, there's a lot of fear when people come for a dental this thing, right? And from one sitting to the other sitting, reducing their anxiety for those instruments could be very helpful for you itself. When they're going for surgery. I had one case, means I've had many, but this lady who had to go for her knee surgery, but she was so scared of surgery, she actually deferred the surgery for more than 5 or 6 years, just because of the fear of operation theater. Means it's not working. The situation is actually worsened because She's tried everything alternative कि मेरा ये करने से ठीक हो जाएगा, ये करने से ठीक हो जाएगा. Finally, when a doctor has to intervene and actually make the structural change or make the change has to happen. But she suffered for 5-6 years for no reason, just because I am scared of the operation theater and the lights that will go, fall on me. So that is like, this is not something you cannot tell somebody to go for a counselor like this. Now people will say, what are you talking? What is this you're talking? But yes, this, things like this can be solved. You have to relieve the fear of the person to go further.
You have a remedy, or if we learn that this is the thing I can give to my patient, we can start like 2-3 days before or a month before, or we can just give and start. So how does that work?
Yes, so when I teach, what I teach is the 38 remedies. What are the basic inputs? For example, there is a flower called mimilis, okay, which is a flower extract which we use, which says fear of specifics that a person may have. So a person, if he has a fear of X, Y, Z, which is very specifically, like this lady was very specifically scared of the operation theater setup. She's so scared to go there that she will not even make an attempt to go there. So those kind of things, when is very specifically, that this is the thing, you're not going to use it for becoming a practitioner like me to work only on cases like these, which are emotional in nature. But yes, in your specific cases, yes, you can learn this and add it as, and to calm the person. There is something called rescue remedy, which is like an SOS, which can be used in any scenario, even otherwise. Okay. So that is something that is an SOS which you can have it in. Everybody should have it, so that it calms the person, at that moment. So yeah.
Okay. So I think questions are over from my side. Do you have any questions? Other people, do you have any questions for her? Pallavi, you shared something. You had asked for a.
Yes, just the 2 slides, which I think are amazing to know the patient's stress level, or to make them confront to their emotions so that they feel the need to visit a counselor.
Okay. Okay.
She wants that 2 slides. It will be available on YouTube as well. We are
Okay.
going live on YouTube with this. Yeah.
Okay, thank you so much. But my question to ma'am is how to convince the patient that they need this treatment, because this counseling, because most of the times what happens when we tell the patient that they need this guard, for example, so when patient gets ready to get that guard, it's an achievement for at least some practitioners like us who are just starting the TMJ practice. But then if we tell them कि अच्छा आपको अभी काउंसलर की भी जरूरत है, तो they may feel कि we are trying to just monetary benefit or anything like that. So how to address this issue? Because nowadays the emotional problems are with everyone. We cannot say that this means, even I am talking, I may have some issues, but if someone tells me, then I may get offended.
So, this is, I'll be honest, this is what I realized, and that's why I became means, of course, I'm not specifically saying unless the person accepts that there's an emotional issue, you cannot say something to that person and you can't push that person to go to the counselor. But sometimes, it is good to tell them that, why don't you read about something like this? If you think that it is going to be, if it is something that relates to you, and if you think this is something that can benefit you, why don't you think considering? Because there's a lot of self-help which batch remedies, at least specifically, which we talk about, can offer. There's a lot of self-help that we can offer through batch remedies, because a lot of times people have apprehension when somebody else tells, a lot of people come to me, but when if you ask them, are you feeling lack of confidence, they may not want to accept that, yeah, their lack of confidence. But if you told them this remedy is actually working for your confidence issue, then they don't mind going and trying that remedy. Actually, they don't mind going and trying that remedy to say, okay, yeah, this is, if it improves my confidence, why not try it? Because yes, I am feeling confident, lack of confidence. So a lot of times, self-awareness or reading about these matters, why don't you read? This is interesting. If you think it is something that it can be helpful for you, then go for it. If not, leave it. You can't really tell them. In fact, even for your therapies, if you think if you give them the literature for the advantages that therapy can give, rather than saying you make a choice. Everybody likes to make a choice.
Right, right.
So you should say that this is the advantage this can have. If you like, you take it. If you don't like it, don't. Because everybody feels, when we are doing something, we are just trying to sell ourselves, and we are trying to sell a service, and we are, putting something because, without reason, we are giving them something. You
Right.
read. If you like it, take it. If you don't like it, go ahead. Like 4 years, she suffered, right?
Okay, yeah, that's true. Is there any specific questionnaire which may encourage the patient to for self-help?
In what sense are you asking, Pallavi? I
I
didn't
mean,
get this.
if we present some questionnaire to the patient during the treatment to address
Hmm.
their deep emotions,
Hmm.
and if they think that they fit into that category,
Hmm.
and there is any, like, yes, what counselor can do we cannot do, but if
Correct.
they get convinced that
Hmm.
they have these issues, and if
Hmm.
we give them a tip or two
Hmm.
as self help, so
Hmm.
that they get their mind gets diverted towards seeking help from any
Hmm.
particular person. So can we do this?
So basically, I do have a questionnaire, where I actually say that how many times do you, how many times do you do like this? How often do you feel X, Y, Z? And you put a scale of 0 to 9. So I do have a questionnaire like this. I can share the link with Dr. Sayogita. See if that is what you're trying to ask. I do have a questionnaire which I put up for selected few people who come to me to understand. See if I'm
Hmm.
addressing your question. But
Yeah,
yes, they have to understand, yes, okay, do you overthink? If I ask somebody, they may not want to accept, okay? But if I
right.
tell them, okay, put it on a scale of this thing or put it on this thing, when it is nobody seeing, no, when the judgment is not there, people want to accept.
Right, right.
Because,
That is,
otherwise they feel, that if I'm going to tell, oh, Pallavi, you know what, I feel very scared. Oh, what will Pallavi think if I say I'm very scared? But I know in my own mind, at least I know myself that I'm feeling scared.
yes,
Okay,
yes,
if you're feeling scared, this is what you can do for it, right? But if I have to tell Pallavi I'm feeling scared, first thing I will think is what will Pallavi think if I say I'm scared?
yeah, yeah, that's
So
true.
that is the time, half the time people don't want to come because they feel, we are going to judge them or we are going to tell them something which, you know, that apprehension is there. But okay, if this is the case, this is the self-help. Okay, will you like to self-help? Then yeah, maybe I'll say, yeah, I would like to get rid of my fear. Is there something I can do by myself? Yes, then I
Yes,
will think, okay, let me go for it.
yeah, yeah. Because this type of approach will actually help them, and it will also contribute to the success of our treatment.
Of course. So that's what I never tell them, you take it. I say, boss, this is it. If you think it is going to be good for you, you choose. I am not telling you. I cannot say that this is, because people think, when you're saying that, you're having XYZ an issue, you're taking stress, we are telling them something, just out of the box because we want to say something and we want to you decide. If it makes you feel like that, then you should go for it. Because I have realized in my years of practice, the the client on the other side wants to be the deciding authority. So I
That's
only
true.
give the option and I say, okay, you choose and you decide what you want to do.
Yes.
Everybody wants to decide, so you decide. If you like it, come for it. If you don't think it is good, no.
Mm.
I mean, that's where I have, that's what I have at least used in my practice.
Yeah, that's a wonderful suggestion, ma'am. And that questionnaire will be helpful for us too.
Sure, sure, sure.
Thank you so much.
Thank you.
Hello,
Yeah,
Suchitra. I have one question. This is Dr.
please.
Chetna from Nagpur.
Yes.
Many, how much time the patient will take from this remedy to recover?
So see, it depends from case to case basis. I'll be honest. It'll be very different for different people. How long a person will take will depend on the event or the kind of circumstances that person could have been. Like it is very difficult. For example, somebody who has, I have a client of mine who has actually lost her son to suicide. Okay. Now, can I give a timeline? Because she does go through a lot of emotional turbulence, right? Whereas a somebody which is simple, so it's very difficult to say how long it will go, because, it depends on, how much she has already gone through or how much she's actually suppressed. Because for her, she was suppressed to an extent where she did have a physical outburst, and there were, it was a psychosomatic to a really large extent. So from case to case basis, it can, for some people it can be very quick, for some people it can take a little longer. But I suggest at least 4 to 5 cycles of meeting. When I say 4 to 5 cycles, when I call somebody, I give them the remedy and I see them only after 21 days. So they come back to me in 21 days of consuming the remedies. So when I say 4 or 5 cycles, it's practically 3 to 4 months is definitely there as a time lag to, see the substantial mood shift.
Are these patches commercially available, or this is with the counselor itself?
No, these are available. There are homeopathic companies who sell. So there are, as I said, now people who are learning, I'm a practitioner, but people who are learning who are from different fields, right? When they are learning, they are actually buying it from a homeopathic company, right? They buy the kit for themselves and then they start dispensing them. Because it doesn't make sense to prescribe it. It makes sense to mix it and give it. So most of the times practitioner just has it himself and mixes it and gives it, because it is need based, because the client on the other side may or may not need it next time. So why will he just buy and keep the bottles? Because the shelf life of this is long. So might as well the practitioner can mix it and give it.
Suchitra, Gopal here.
Yeah, hi Gopal.
Yeah. So I want to ask, is it just giving the medicine or it also involves counseling, both mixed therapy?
So see, when somebody comes specifically for example, somebody is coming to me specifically, it's coming with a counseling. I just don't dispense. I have to listen to the person, understand what the person is doing. But for example, now if a homeopathic doctor, and usually specialists or those kind of doctors, they do have a rapport with their clients. It's not like the clients will just come one off and not come the next time. So there are certain behavior patterns of the client, you are very clear that, okay, this is what will help the client. So in those scenarios, I don't think everybody is sitting to counsel, but yes, in some conversation, for example, even when you are doing some dental work, you do get into conversation with the client, right? Or your patient. And you do judge some things and you think, okay, this can be there, this can be helpful. If it is going to be detailed work, yes, it is going to be a longer conversation, but when it is like supplementing your own work, there is very little time that you will be wanting to spend. You will say, okay, these are the things that I think will help and probably help with that. But yes, when we sit for consultations, it's a good 1 hour talk that we do before we dispense, because we are very clearly only working on the emotional side.
Okay, thank you.
So Suchitra, one thought comes in my mind. If we do a course with you or something, we can dispense it for our patients. But that is an extra thing which is there, which we have to learn, right?
So see, basically there are 3 levels to it. Okay, I'll tell you what, there are 3 levels to it. When we teach level 1 becomes like a self-help. People who are like regular people, like I get people like housewives, or I get general people also, general corporate going people also. So level 1 is the level where we teach the basic, where you do self-help also, and you can work for close ones around you. Okay, that is level 1. Level 2 is basically so you understand the emotion and give. Second one is more like detailed for people who want to take it professionally. What they do is you need to understand the personality type, you need to understand more, because we are going to be only working on the emotional side, right? We don't work on the physical side. So for that, level 2 teaches you personality as well as what are the moods that can be there, and level 3 actually teaches you how to do practice, how to engage and make sure that you get everything out of that person to understand his emotion. So in this case, level 1 is, a lot of people do level 1 for self-help, learn the level 1, do for self-help. People who want to professionally call themselves practitioners, then they do have to, do level 1, 2, and 3. And, at level 3, there is an examination and case studies to be given. But that is also because you have a separate category called you're a bachelor or practitioner.
I want to share an experience here. What happens is in our TMD practices, we ask patients to wear splints, they wear, but it is like when a person goes for a weight loss and he just goes out to gym, but he eats as well. So it just balances itself. So in splint therapy, if we go along with an emotional therapy, if you find the patient is stressful or something, it helps. Now, if we say patient, we tell patients ki jao, you need to exercise, you need to relax your muscles, you need to do yoga, you need to meditate and all. But people don't meditate as such. So when we put them on bach therapy as well, so it gives an additional benefit, which is faster. Yeah.
So I wouldn't say that it is. So the thing is, see, for example, what happens? Suppose I am feeling scared for one particular thing 100 times. For example, it's just an example. So how batch will reduce is basically reduce the frequency of feeling fearful or feeling anxious. So what happens? You slowly become 90. So your physical recovery is also happening. Your feeling of fear is also become 90, then it becomes 80, 70, 60. Then what happens, the frequency changes to feeling anxious once a week, then you become feeling anxious once in a month, and then 6 months. So that thing gets spread out over the period of time, and then you realize that, yeah, okay, I'm not feeling any. This is for typical cases. I'm not saying that it is going to be for every case, the frequency is going to come only after 6 months, that you're feeling once in 6 months. For some, it can be really fast. For some, it can be it can take its own time.
Better than taking Alprax at night every day and sleeping or taking other antidepressants. It is better to start with a non-invasive thing.
Yes, yeah. A lot of sleep issues are, and now I think a lot of work stress is going to be one more thing that people will talk about, because I think so there is a lot of anxiety cases already piling up, saying that this COVID has created. So there's a lot of anxiety at every corner. I'm not saying just work related, but otherwise also there is anxiety everywhere. Yeah.
Suchitra,
Hmm.
Dr. Nilesh here.
Yeah. Hi.
Hi. So are there any chances that the patient may develop dependency on this?
Not really. It's not dependency. They're not habit forming, if that is what you're trying to ask. They're not habit forming. But what happens is, suppose now I am, now my frequency has become such that, I don't get this XYZ thought for a very long time. So I like that space, okay? And then once in a way, for example, it does come because of external events, okay? Then I would rather say, okay, let me just, this is what helps me. I will, might as well not get this. But it is not a habit forming. It's never come across as a habit forming thing. But, because they know that their mind is calm, some people do continue to, make this as, lifestyle change. Saying, I don't know. I know this is my problem is like, I always fear for my child, and I know this is there. And this is irrational for me. And for some cases like those, it can be like you are taking it for a long time. Like, as I said, the case that I was talking about, she doesn't want to even think once about it. So she may want to just choose it that, okay, this is a lifestyle change, just like I would do a lifestyle change for my food habits.
Okay.
I would want to do a lifestyle change, but it's not an habit forming thing.
Okay, thanks.
Suchitra, Gopal here.
Yeah, hi.
Can we think it in long term, taking this medicine can change any personality? Is it possible?
Change personalities.
Yeah, personality changes in long term with this medicine.
So
Is it
see,
possible?
what happens, I'll tell you, we are not trying to change the personality, we are trying to change the behavior pattern. What I mean to say, saying personality, a lot of people, think, a lot of mothers come to me when their kids don't talk and ye kam baat karta hai, he's introvert, and see, I'm not, if he's introvert and he doesn't like to talk, I'm not going to push him to talk because that's his personality. But if he's not talking because he's fearful of the crowd, then that's a behavior which is actually obstructing his, overall development. He's creating more complexes around him. He wants to talk, but he's not able to talk. So that is where I would want to say, I'm not saying that, today you're like this and I will change the personality. I'm not intending to do that. And that's not what bach does anyway.
Okay.
What exactly is the mechanism of action of this therapy? Can you explain a bit?
So basically, now if you were to ask me, is there a clinical trial or something? I think you're hinting there, right?
Not really too much of a clinical trial, but how do you explain how it works? Like at what level it works? Does it stimulate some centers in the brain, or like how exactly does it work? Any idea?
So basically, the whole concept is that the flowers have an ability, they have a particular characteristics, and you are consuming them to actually get the characteristic of a flower. As we say, a smell in the room just elevates the entire room, a small box. So you are basically, taking the properties of the flower which you are consuming and you are elevating. So for example, the flower's properties are here and you are here. So gradually you are going to come here. That's where I would say the frequency of the flower is what I will put it as. The frequency of the flower is such, and you are matching to come to the frequency of the flower. So they are called vibrational medicines actually. If you, in other terms, that other words that people use for them is vibrational medicines.
Yeah, and any studies like you just mentioned, is there any study?
So there are a couple of them where they have, said that, because there are a lot of, as I said, there's no proven study to talk about it, and you can't clinically prove that, okay, this is what it is. But a lot of studies from placebo effect and those kind of effect and how it has enhanced a couple of them, that is definitely available. Even on Bach Center's website, it is available. So there have been a lot of homeopathic associations which, since it is inspired from there are certain of them that have done, but there is no like scientific formula which is attached with these.
Thank you.
So I think there are no more questions. Suchitra has something for you.
Oh, thank you.
Thank you, Suchitra. Thank you. Every time you come and you enlighten us so well, and every time whenever you come, I also learn a new thing from you. So
Thank you. Thank you so much, and thank you for having me as an audience here. Really thankful for that. Have a great learning session ahead. Dr. Avinash is going to keep you glued. Bye. Thanks for having me. Bye.
Thank you, ma'am. Thank you very
Bye.
much.
Bye.
Thank you, Dr. Suchitra.
Bye.
Hello.
Bye.
Thank you.
Hi.
bye. So now we will start with तुम्हाला राहायचंय का हे?